Morning and welcome to the weekly dementia blog. My name is Dr. David Hutchings, and as always, these are being sponsored by Spectrum Ed. Really excited about how much views we're generating on these videos. It was our goal really to be able to bring a very complicated world, a very complicated diagnosis of dementia, and bring it to not only the public, the caregiver, but also provide some helpful information to the caregivers and also the practitioners. So really excited about how many views that we're generating and really kind of getting the word out that there are things that we can do for these patients and especially the caregivers. So let's get started. We have been discussing over the next 3-week period here the importance of therapies in dementia, and not just Alzheimer's. We're talking about all forms of dementia. And last week we talked about physical therapy and mobility and the impact of falls. I was just talking with the patient's family yesterday, and their mom had a fall who has Alzheimer's. She's a patient of mine, and they had a rapid decline of cognition after that fall. So I think that we talked about that area, but this week we're going to talk about occupational therapy, and next week we're going to talk about the importance of speech language pathology. So occupational therapy, I know all you practitioners know what OT is. For those of you that are not familiar with occupational therapy, they bring a lot of the functional things into their therapies and incorporate that into teaching patients their activities of daily living and their IADL. So ADLs is the activities of daily living. These are being defined as basically everything you do is an ADL. I was doing quite a bit of research on this prior to the blog, and it's basically everything. You're bathing, you're dressing, you're eating, you're toileting, you're getting dressed, and it extends onto that like your IADLs. Are going to be more advanced things like handling your finances and driving. All these things are extremely important. Driving is one of the ones that is the toughest to take away from our patients because it's taking away a huge level of independence. So occupational therapists are going to be critical for the assessment and evaluation to tell us, are we able to drive? Do we have the cognitive abilities and also the functional abilities to be able to drive? So that's very important for the patient, but also it's extremely important for the caregivers. We've got a lot of great research that's indicated that working with the caregivers and also the patient to increase ADL independence, or maybe increasing those routines and teaching the caregivers those routines, can help reduce hospitalization, and also right with that is decreasing caregiver burden. So some of the 3 things I want to talk about briefly in occupational therapy is remediation, maintenance, and also modification. So think about this all as it kind of rotates around the activities of daily living, the bathing, the dressing, toileting, getting dressed, all these things. Remediation is we know that we're not going to get the cognitive skills back. So occupational therapy really incorporates routine exercises to help increase that ADL performance. And not only being able to carry out those ADLs, but also at the same time increasing our strength and our range of motion and also our endurance. Number 2, maintenance. Occupational therapists are going to work with the patients and also the caregivers to develop routines to help maintain ADLs as long as possible until the patient has the next decline. Now, we will get to a point where we have such a decline that we have to move towards more the third, which is the modification, and it's used the most frequent in dementia. And that's where we learn how to use adaptive equipment to help with the ADLs. What type of verbal cues can the caregivers use to help increase ADL performance? And also, what are some of the easiest ways to perform some of the ADLs? So if we have a caregiver that's bathing his spouse or her spouse, and they can become injured doing that themselves. So occupational therapist is going to teach them how to do that the easiest way that's safest for them and the patient, and hopefully decrease some of that caregiver burden. Again, occupational therapy, we can go on and on and on. We can literally go into every single ADL and also go into what ADLs break down at what dementia stage, which is extremely important. So it's no wonder that we refer to our occupational therapists very, very often in the world of dementia. So looking forward to next week, we're talking about nutrition, weight loss, and pneumonia as it relates to speech language pathology. So that will conclude our 3-week series So very excited about that. And again, very excited about all the views. Y'all keep the questions coming and keep the topic suggestions coming as well, because that's what's kind of generating this week by week. So again, excited about next week, and thank you very much.